Good afternoon. My name is Ashley, and I will be your conference operator today. At this time, I would like to welcome everyone to the OPA Report Card Industry Briefing. All lines have been placed on mute to prevent any background noise. After the speaker's remarks, there will be a question and answer session. If you would like to ask a question during this time, simply press star, then the number 1 on your telephone keypad. If you would like to withdraw your question, press the pound key. Thank you, and I would now like to turn the conference over to Elizabeth Abbott. Please go ahead.
Thank you, Ashley. This is Beth Abbott. I'm the Director of the Office of the Patient Advocate, and I'm very glad you all joined us today. Just as a housekeeping item, I want to remind people that we are recording this call, and so we typically do because we put it up on our website, and in case anybody wants to listen to it again, so or new staff, people who are absent, not able to attend. So I just wanted to tell you that as part of the protocol here. We wanted to give you a briefing today about what the upcoming launch of our report card is going to be in October. This is not going to include data, your data or anybody else's, but we want to highlight for you some of the changes and some of the new things that are going to be in the 2016-17 report card. I am sure that several of you who are on this call have been involved in this information for several years and are perhaps as thoroughly familiar with it as we are, but we try and do this every year about now in July to refresh everybody's memory about how this operates and where we get the data and what it looks like and how we present it and everything you want to know. We're happy to take questions at the end of this, but we have tried to anticipate what questions you might have, so we would ask people to hold them till the end. I have been at OPA now for about 18 months, and I'm super pleased to be here. And in addition to Allison Berry and Ruben Mejia, I'm happy to announce, and Monisha Avery, our deputy, I'm happy to announce that Claudia Coons is our newest staff member who'll be working on report cards, and we're glad to have her as well. This preview is designed to advise you about changes, and it will give us an opportunity to sort of cover the landscape in both a general way and in a more detailed database way. 2016 has been, I would say, a banner year for the Office of the Patient Advocate. We have added, and if you haven't looked at it, our website recently, you better do it because it is pretty interesting stuff we have added. We've added the total cost of care for medical groups. We have reissued what many of you may have seen on the Integrated Healthcare Association's website, the Medicare report card, which they have willed to us because they wanted it to have a little more visibility on the same site where the commercial quality data is. And we have spent a good part of last year and this year developing the new first-in-the-nation consumer complaint data report, which has complaint data from the Department of Managed Healthcare, from the Department of Insurance, from the Department of Healthcare Services, Medi-Cal data, and Covered California complaint data. We're the very first state doing this, and it's, I think, really swell. So it's not perfect, but it's, I think, a very good inauguration of that important consumer data. We're going to talk throughout the balance of this briefing what's new and what are some of the standard protocols and timelines and content for these report cards. And on the longer range trajectory, I want to make sure you're aware that we're working closely with the Department of Managed Healthcare to display, they're not quite ready yet, but the timely access to care information and other significant work products with other partners. And I think they are quite really taking hold, and people will find them interesting, and consumers will, and health plans and medical groups will. We have a number of partners that we work with in all these endeavors because we couldn't do it without them, and I wanted to particularly call them out. The Integrated Healthcare Association, the folks are most fondly known as TIPI, the California Healthcare Performance Information System, California Department of Insurance, California Department of Managed Healthcare, NCQA, who is our public reporting contractor we work very close with, and their subcontractor, the American Institutes for Research, AIR, who do all of our consumer testing for us and give us ideas about display and language and other kind of navigation sort of things on our website. So we couldn't do any of this without all the people who help us. So I hope you find this worthwhile, and please write your questions down as we go along, because we're going to probably go kind of fast. But I'm going to turn it over now to Ruben Mejia on our staff. Ruben?
Thank you, Beth. As Beth stated, some of this might be repetitive from previous years, and you all may know a lot more about this than some of the newer folks on the line. But I'll do an overview of the report cards. This 16-17 edition of the report cards will contain measurement year 2015 clinical performance and patient experience scores and data displayed in 3,000 charts. They will have updated profile pages for the 16 health plans and the over 200 medical groups. And these cards represent care for 16 million commercially covered residents of California. We expect the report cards to be released in October, as was last year, and in time for open enrollment for millions of Californians. As you can see by this slide, that these are the images of the current report cards for the 10 HMO plans, the 6 PPO plans, and the over 200 medical groups that contract with HMOs. The colors and the columns are kind of the OPA brand, designed to be easily read and deciphered, and the information to be quickly and easily understood. And we highlight key information about what's on each page. Our target audiences range from very sophisticated industry folks such as yourselves on this call, researchers, purchasers, and the everyday consumer trying to find reliable, independent information to understand their options in making informed decisions. At OPA, we regularly receive phone calls from consumers, and we're able to walk them through the report card, and overall the feedback is generally positive. The data sources of the report card. OPA relies on collaboratives. We partner with national and state organizations focused on improving and reporting on healthcare performance quality. And the clinical care data comes from HEDIS. The medical group data comes from HEDIS and non-HEDIS measures selected from the IHA P4P program. The patient experience data comes from CAPS, from NCQA's Quality Compass, as well as from the patient assessment surveys from CHIPI. These collaboratives are made up of healthcare experts who develop these measures, researchers, healthcare providers, healthcare plan staff that focus on quality, performance improvement, and purchasing for employers and others. The advisory process is an important step in OPA decision-making. We seek advice and information from experts in the organizations who contribute to the production of our report cards and strive for transparency, collaboration, and alignment. Our advisory process includes the IHA's Technical Measurement Committee, which reviews and advises us on HEDIS and non-HEDIS measures and CAPS methodology changes. We work with CHIPI in their independent decision-making process related to medical group for the PAS patient experience data. OPA also consults with an independent academic expert, Dr. Patrick Romano. Medical group and health plan reps annually review such as yourselves, review your star ratings and organization information as part of the quality assurance process. A preview will be held in September for this. We will provide more details shortly. And then also OPA works to align our report cards with Covered California as best we can. This image illustrates an overall summary ratings page and provides an immediate picture of healthcare quality for each of the listed organizations. The page also includes quick links to the conditions and topic ratings, both clinical care ratings in the dark blue box and patient experience ratings in the light blue box on the right-hand side of the chart. This next image is an image of the condition and topic summary rating page. This one's for asthma and lung disease. This provides immediate picture of quality for each organization on specific healthcare topics, as well as quick access to the specific measures that go into the star rating. It's kind of hard to read on this presentation, but that blue box has the links for those specific measures. The measures page shows percent of patients getting the targeted service or reaching the targeted outcome. This one's for immunization for children. The health plan report cards include a reference line showing the national 90th percentile for that same type of plan. HMOs are compared only to HMOs, and PPOs compared only to PPOs. There's limited text shown on this page view right here, but if you click on the upper left-hand where it says read more, you can learn more about what is being measured and why, as well as the source of the data for this measure. And this is a sample of the measure page description. This one's for asthma medicine for adults and adolescents. This is the full measure page, and all the descriptions use the same format as this. We seek to let users know more about why each measure is important, what their doctor should be doing regarding the healthcare condition, what the patient can do, where the data comes from, and what the rate means. We make sure users also know that both the doctor and the plan may have additional programs and services to help the patients with their specific healthcare condition. With that, I turn this over to Alana.
Ruben, thanks very much. This is Alana Burke from NCQA, and Ruben just gave a nice overview of how the website and report cards themselves are structured, and I'm going to go through a bit of the methodology and then highlight some changes for the upcoming edition. So the OPA methodology is based on relative comparisons. So cut points are assigned for the star ratings for all of the clinical and patient experience measures. And those are based on prior year performance. And the only exception to that is if there has been a significant change to measure specifications that make it so that we're unable to compare to prior year performance. And in those cases, we use current year data. For the HMO and PPO report cards, we use the HEDIS all lines of business data from NCQA's Quality Compass to establish those cut points. And for the medical group report cards, we use the aggregated all participant data from the IHA value-based performance, pay-for-performance program for the clinical ratings. And the patient experience ratings on the medical group commercial report card use methodology and cut points developed by the California Healthcare Performance Information System, or CHIPI, as many of you know them. And so those cut points are selected to a prior year for a set period before the bar is updated periodically. And you can see there are 4 star ratings on this. So that's consistent throughout all of the report cards. So as we've mentioned, there are both aggregate star ratings and then all the way down to individual measure ratings are displayed. So in terms of clinical ratings, there's 1 overall summary clinical rating for each report card, and then up to 9 condition summary topics, and you can see those listed here, and up to 47 individual measure rates are displayed. And then in terms of patient experience, For the medical group report card, there's 1 overall summary star rating for patient experience and 5 summary star ratings for specific composites. And on the health plan report card, this is actually one of the changes we're going to go through for this year. There's going to be 1 summary star rating for patient experience on the plan side as well, and some topics underneath that, and up to 14 measures for each of the health plans displayed. So as I mentioned before, all of the data compared to prior year cut points for health plans, that is all lines of business, and for medical groups, that's to other medical groups. I think this slide may be a little bit of a repeat. When a measure has major changes and results in a break in trending, we would use the same year of data to compare to that measure. For this upcoming edition, there are no instances of a trending break. And we also just want to point out that there are very detailed methodology descriptions, more technical documents available on the report cards themselves. The links are provided here. This is for the current edition, and those methodology documents will be provided prior to the industry preview in September for the upcoming edition. Okay, so to go over some of the changes that you'll see in the upcoming edition released in October 2016. So I kind of previewed this a little bit a couple of slides ago, but for the CAPS methodology, that's the patient experience ratings, there's going to be 1 category level star rating for patients rate their experience and overall summary. That's going to be comprised of 3 topic ratings, getting care easily, which is already, that's something that's already on the report card, satisfaction with planned services. This is a topic that's very similar to the HMO or PPO helps members get answers topic that's already displayed on the report card, and satisfaction with planned physicians. And you can see these 2 new measures in red, rating of doctor and rating of specialist, are the only 2 measures that we're actually adding with this change. The other 3 measures are already reported. So this is more of a restructuring of how the measures are organized with just a couple of those additions. And I would like to note the topic names satisfaction with planned services and satisfaction with planned physicians. That might not be exactly what they're called when the report card is released in the fall. We're still kind of working through the best consumer-friendly names for those topics. So just wanted to point that out. And this is a quick preview of kind of highlighting how that changed. So you can see the current HMO report card has a single topic, single category rating for the clinical care. That's on the left-hand side with the dark blue above it. And currently there are 3 ratings displayed on the summary page for patient experience, and those will all be rolling up into 1. But as I said, you'll still be able to drill down to those 3 topics and then drill down further to the individual measures as you can now. So in terms of new measures that may be added, in addition to the 2 that we just talked about on the plan side, on the medical group report card side, a new measure that's going to be reported this year is controlling blood pressure for people with hypertension. This is going to be what we call a standalone measure, which means it will be displayed at the measure level, but as of right now, it does not roll up into the star ratings. So the description of the measure is here. We'll be reporting the total rate. And then another measure that, for those of you who have been familiar with the report card for several years, the successfully controlling diabetes measure will sound familiar to you. This is a combination rate, a diabetes combination rate from the value-based P4P program. And it was not on the report cards this past year because the old combination rate had been retired and a new combination rate had been adopted by the value-based P4P program. So now it will be back on the report card. And a couple of changes to existing measures. So for the testing blood sugar for people with diabetes, and for those of you more familiar with the kind of technical measure specifications, this is the HbA1c screening indicator. Again, this is following changes with the value-based P4P program. The current single HbA1c indicator was retired, and a 2 HbA1c tests per year indicator was adopted as part of the value-based P4P program. So that is that change will be reflected this fall. And one other change, a measure that has been on the report card for quite some time, is the controlling blood pressure for people with diabetes, which this was the only measure on the report card that had an outlier criteria in the past, and that outlier criteria has now been removed. So all scores will be displayed and used to calculate this measure. So those are kind of the major changes coming up, just some important key dates to keep in mind, and we will certainly be in communication with more specific details. Every year we do solicit profile updates from all of the medical groups and health plans. So the profile information are things like your website, your phone numbers, what counties you serve. And if you at any time see something on the OPA website that is incorrect regarding your organization, please let us know and we'll make those updates. But we do solicit specific updates every summer prior to the fall launch, and you should be receiving communication about that likely early next week. So I wanted to point that out to everyone so you can look out for that email. As both Beth and Ruben mentioned, we have a health plan and medical group star rating and profile page preview, as we do every year, for the medical groups and health plans to preview their data prior to the public launch. That will be in September. Exact dates haven't been scheduled yet, but again, you'll be receiving notices of that in the coming weeks. And again, as Beth and Ruben both mentioned, we're planning to release the report cards in October of 2016. And one more thing that I wanted to point out, we've been talking about the health plan, that's the HMO and PPO report cards, as well as the medical group commercial report card. And Beth did mention at the top of the call that OPA is now also publishing the medical group Medicare report card. That one we are still planning to release a new version of this coming fall or winter. It's on a slightly different schedule, so it will probably be a bit later than the commercial report card. So just wanted to point that out, why that one wasn't mentioned here. And then just to kind of, again, keep everyone in the loop of thinking about 2017 and forward, there are some new measures that may be available, that are going to be available for public reporting. So as part of the value-based P4P program, the current cervical cancer screening measure is being retired and being replaced by a cervical cancer screening and a cervical cancer over-screening measure. So those will be available to be reported on the report card, and we'll be thinking through the best way to display those and explain those to consumers. Beth did mention earlier, we're working closely, OPA is working closely with the Department of Managed Healthcare on timely access to care data. And, you know, we are always conducting consumer testing and looking at ways to improve the usability and functionality of all of the report cards for consumers. So we are always happy to receive feedback from stakeholders. So please let us know if you have any ideas. And with that, I'm going to turn it back over to Beth.
Thank you for bearing with us and listening to this. We're very happy to have you. This is, I say it with a considerable amount of pride, this is the 16th year of our report card. And if you've heard me say this a bunch of times before, please forgive me. But the OPA report card from California was named the #1 report card last year in the nation. Not every state has one, There are other report cards that get an A rating, but then they're rank ordered. We were first. And probably immodest of me to keep mentioning that, but you'll have to bear with me. I think it's with input from you and the work with all our partners that I think we are striving for real excellence. I want to put a pitch in also about looking at your profile page. Alana mentioned that. And we do due diligence on the report card, but I have to confess it is mostly about make sure we get the data right and the attributable to the right health plan and medical group and like that. We do look at what you put on your profile page, what hours you're open, how to reach you by phone, what your website is, stuff like that. And every year we counsel you to look at that. And you should probably have a periodic check on that anyway without a reminder from us. But last year, I was pretty surprised that one health plan was still listing a separate number for healthy families, consumers to call up for information. And, of course, the Healthy Family Program has not existed. It's the SCHIP program. It's called Healthy Families in California when it existed, but it has not existed since 2011. So we do catch errors like that, but I would venture to say that that health plan had not looked at their page. And so we ask that you do look at those and call to our attention anything that looks not right or that you have elaborated on or changed or made differentiation of how to reach you and what services you offer. So we can't do this without your help to make this a good report card. And I'm happy to entertain questions, any of us are, that you have about what we presented and or things we didn't mention that you'd like to know. Well, I guess the other thing I might say is we are not being slackers about the Medicare report card. It's just that CMS doesn't make the data available quite as quickly as our colleagues in California. And so that's on a different scale, but not because we want it to be necessarily, but it will be available after the first of the year. But I wanted to explain that that's why it's on sort of a different timeline. So, Ashley, maybe you would remind everybody again how they can ask a question, and we'll entertain any questions, and we'll try and give you answers.
At this time, if you would like to ask a question, please press star, then the number 1 on your telephone keypad, and we'll pause for just a moment to compile the Q&A roster.
While we're doing that, why don't you advance the slides to our contact information, Alana, so people can write down if they want to say, ask questions offline or know how to get in touch with us and ask rude and embarrassing questions or otherwise, they can do so. And we've listed everybody here that on the OPA staff, but our colleagues at NCQA are also excellent at answering questions in helping us consider what issues you are raising and getting you particularly specific database questions to your answers to your questions. And then maybe we should show the final one slide about Facebook and Twitter and all that jazz. Those of you who are social media mavens can do this. And not so much direct questions to us, but it is, in fact, another way to reach us.
Yes, and I did get a couple of questions online. I think I'll handle the quick logistic ones first. One was how to get a copy of this presentation. So Beth mentioned at the beginning of the call we are recording this presentation and it will be posted on the OPA website in probably sometime next week. So that's how you can get a copy. And the second kind of logistical question was when the preview is released in September, can we make corrections and how do we go about doing that? So the when the preview happens in September with the actual data, that is the purpose of it, is that for all of the medical groups and health plans can review their data and make any corrections or ask any questions about the methodology and the ratings, and all of the instructions for how to do so will be sent with the information about those previews. If there is profile information updates, as Beth mentioned, things like phone numbers, websites, things like that, then that we are going to be soliciting that earlier, so that's probably next week you'll receive an email about that, or you can email us at any time and give us that information. And ideally, we'd actually love to have those updates prior to the preview period in September, because the preview period in September, we're really focusing on the ratings and data, although we will accept, of course, any profile corrections at that time as well. Ashley, are there any questions on the line?
Can I add one more thing to what Alana said? Our plan is really not to ambush medical groups or health plans with the data. So we give you a finite period of time, but a reasonable amount of time to look at the data. But it is something you should already be familiar with from your other sources, your dealings with IHA and your own quality information tracking. So if you see things that don't look right to you or you have questions about, we're in a crunch when we're doing these as we're about to reveal the report card. So if something doesn't look right, don't hang back. You can talk to us about it. You can talk to NCQA. You can talk to any of our partners on this, because we want to get this right, and we'd probably like to not do it at midnight before we release these, okay?
And your first question comes from the line of Ed Yu.
Hey, thank you very much. I heard that there may be, the OPA may be moving from a 4-star to a 5-star rating system. Is there any validity to that?
This is Beth. The answer is a definite maybe. As you know, what we're looking at, and we don't know the answer to that question, we're not being coy about it, it's as the national quality rating system starts to coalesce around standard measures and standard depictions of quality measures, CMS seems to be greatly committed to a 5-star depiction of that. And I would like us to be aligned with other national and state quality rating systems. But it is a big production to change that, and it is hard to make sure that you have equal and accurate gradations between stars so that they're meaningful and they're not the tiniest little variation, so it's not really worth the cost and doesn't really impart something new to the consumer. So I would say it's under consideration, but we're in an early investigatory state, and I don't know what the outcome will be. I would say maybe, maybe not.
Thank you.
And your next question comes from the line of Yvonne Sutwater.
Can you hear me?
Yep.
Oh, okay. Can you please define timely access, because I've seen different measures, and I would imagine that we're following the Department of Managed Care goals.
Yes, absolutely. You are absolutely on track. This is Beth. There was a law that was passed in 2002, which is 2179 Cone, that laid out the obligation in California to provide timely access to care. It's actually implicit in the Knox-Keene Act of 1975, but there was a long time before that was converted to elapsed days measure of what timely access to care is, and it is a really important consumer measure and a performance measure for plans and provider groups. If probably the easiest place for you to find it is on the Department of Managed Healthcare website. They've just issued in May their very first timely access to care measure for 2014, and they acknowledge themselves. I'm not saying anything about them that they wouldn't say themselves, that it's the first year, and they are measuring that, but it's really in its infancy, and they're going to do a report every year on it. And so their metrics for that, and it's based on the type of service. If as a consumer you are looking for a routine appointment with a primary care physician, it's a different. Of course, anybody can always go to the emergency room because of laws, federal and state laws that control EMTALA. But it is about seeing your physician. And then there's a routine measure and an urgent measure. And then there's also one for a specialist beyond PCP that have elapsed days. So it is very clear. The confusion for consumers is, what does it mean, timely access? How many days and minutes is that? And so when the regulations were written, there was lots of input from health plans and medical groups and physicians and mental health providers and all of that to say, well, how do we define this? And so it is taken a long time to get this going, and how do we measure, how do we define it, how do we enforce it? So that's a very short answer to a kind of a complicated question, but if you haven't looked at the MHC's Timely Access report, you should look. Their next one is coming out, and they said publicly today, I heard them say it, that the second one is probably coming out by the end of the year or first of next year. So it's a yearly thing, and it measures it, and is a really important measure. So that's probably not the full story, but that's a chunk of what the answer is.
Thank you.
And again, if you would like to ask a question, please press star 1. Your next question comes from the line of Doug Sullivan.
Hi, I'm looking at your website right now and see your report card shows the top 10 HMO ratings for California. Are you going to show a list of everything else?
You want me to answer that?
Currently, we only do the ratings for those 10 HMOs, as they're the most. They have the most enrollment in the state.
Well, the most enrollment based on commercial, you mean?
That is correct.
Yeah. The other thing that is a factor in that is that there's a lot of plans that do business in the commercial market that are doing business in California. And they sometimes are situations where they can't be rated on particular measure because they don't have enough enrollees. And we found over a period of time that it's a lot of work, for one thing, to put just the 10 biggest plans on there. But if we start getting down to smaller plans, we actually don't have enough measures to put in there. And in fact, I have to tell you this, that you may find this really strange.
Well, let me, before you go in that direction, this is actually for bigger plans, and then I'm looking at other state websites that do this, and they actually have a section where they do the Medicaid plans. So some of those are quite large, and
and getting larger.
For them. Yeah, so is there a rating system for them?
I actually spent this morning talking to a group of people about that very thing, and the Department of Healthcare Services is trying to put together some quality metrics to show this for Medi-Cal plans. And I think California has, I listened to people a couple weeks ago, in DHCS people, I said to them, we're moving people by the wheelbarrow into Medi-Cal. And they say, oh, no, Beth, we're actually renting buses and moving them in there. But it's very important, and I think we are happy to work with our colleagues and have worked in some preliminary information about how we give quality information to Medi-Cal plans. We're also working a lot with Covered California to coordinate with them because they have some different measurements for the individual market, small group market. So that is actually true. And they are going to be big plans. They are sort of the same and sort of different than some of our big plans in the commercial marketplace. But the only other thing I was going to say...
They're not licensed plans. Many of them are.
Many of them are not, but many of them are. And as many of you probably know, there was a movement in the legislature last year to regulate and put all Medi-Cal plans under Knox-Keene. And I think if that is, I don't have any idea. That's not my job to know that, but it seems to me that might be another thing that would lead toward greater quality metrics across the whole span of doing business in California. And I want to add one thing I was going to tell you before. Actually, we get probably 3 or 4 requests from small health plans that say, could we be rated by OPA? That may sound outlandish. That's when we want to be rated by us. But we have had to turn them down because of resources available to do that and how applicable it would be. And we set a threshold of they have to have enrollment of a certain amount. But your point about Medi-Cal plans is a really good one. You should express your interest to our colleagues at DHCS. They would probably like to know that you're interested. And I think they're moving in that direction.
Yeah, I've been to those meetings, and I know they've been talking about that for years, but they haven't moved forward with it. They seem to want to bring it down to a provider level, rating them, but they don't talk about rating the HMO.
I don't know what to tell you about that. I'm not their boss. I'm a quality queen. I want to have lots of quality stuff in the open, and they have been talking about it for a long time. And they have a huge program with a lot of beneficiaries, and we are ready to help them any way we can to get their quality data. They're talking seriously about it. I was 3 hours today earlier before I hooked up with you guys. They were talking about it in a lot of detail. And I think
that's good to know. I hope we see something in the near future.
I hope you don't call me up and ask me about it some more in 6 months. But you should talk to them too, again, because I think they're really examining it now. And I think I don't know exactly what organization you represent, but I think it's worth saying we need to move this into the Medi-Cal arena and have comparable data for the folks who deliver services to people in that program within our state. So I think you should say that.
I will. Thank you.
Yep.
So we have a few methodology. Go ahead, Ashley. I'd like to take the questions on the phone, and then we do have a couple of methodology questions online that I want to get to if we have chance. So next phone question.
There are no further audio questions.
Okay, great. So a couple of the questions that have come through online. One is, when will we know which clinical measures will go into the star rating calculations? So all of the changes, measure additions have been listed in this presentation. So if it was listed in this presentation as a standalone measure, then it will not be going into the star ratings. Otherwise, it will. And so I guess the short answer to that is to look at last year's methodology and add any of the changes that were outlined today, and that is kind of how you'll know for the coming year. But generally, there are not big changes year to year of which measures go into the star ratings, and if there are, they've been highlighted here. And as we said, we'll also be sending out the methodology documents, which have all of that information prior to the preview period in September as well. And another question on methodology was, are the cut points for the current year available? And yes, they are. So for the current edition, the one that's currently on the website, earlier in the slides we had some links to those methodology documents. That is where you can find the STAR cut points there. If you look at those and let us know if you have any questions. And again, for the upcoming edition, we'll be providing those methodology documents prior to the preview period in September. So that's when you'll get the updated cut points. We're currently crunching those numbers right now. Just kind of want to go through, make sure I don't miss anyone's questions. There is a question about the methodology regarding preventing hospital readmissions. So I'm not sure if the person asking this question wants to know about the kind of methodology of the measure specifications, how that measure is actually collected. The measure specifications all come from the partners mentioned earlier in this presentation. So on the medical group side, the specifications would be found with the value-based P4P program. And on the health plan side, the HEDIS measure specifications, so that's the plan all-cause readmissions measure in HEDIS and the all-cause readmissions measure in P4P. Those rates for display on the report card, they are risk adjusted, and then they're actually inverted so that they are higher is better. That's something we do specifically for the report card because it's consumer facing. So there is more information about that in those methodology documents. And again, feel free to reach out if you have more detailed questions about that. And just want to make sure I get through all of the questions here. One question is, can you speak to the inclusion or exclusion of the cost data on the medical group report card? So I'll just give a little bit of background, which is that this past year in March of 2016, the total cost of care rating that is measured by the value-based P4P program was added to the medical group commercial report card. And that is going to be part of the report card going forward. I don't know if, Beth, you want to add any more about that?
I mean, I think that's true. I mean, it does come from the IHA measurement, but that also is something a long time in the making. They have been validated. Before we posted in March of 2016, IHA had been working with medical groups on this and health plans. We couldn't have had cooperation and to do this if we hadn't had both of those groups working on it. And they have been validating that data for 6 years. So it's not something that anybody came up with in January and we posted it in March. It has a pretty detailed run-up and verification and validation. And those of you who are active in the IHA briefing I'm certainly not active because I'm not a medical group, but they give all sorts of information about that in their newsletters that they send to people. So it's, I think it's pretty reliable information. It doesn't say, for those of you who have not seen, it doesn't say you can get, if you go see this doctor, you spend $65 for an office visit. It doesn't say that. But it represents, and some pretty key metrics, what kinds of expenses are paid for by the health plan and the consumer, and how that ranks into a high, higher, average, low, lower general categories with corresponding dollar amounts. It's pretty detailed, and I think it's a good thing to measure. And as it's based on the premise, just I'll say this one last thing, that you don't necessarily get the best healthcare in the world by paying a lot more money. There's a lot of things that go into the calculation of healthcare costs, some of which medical groups have control over, some less so. But I'm pleased that we have that information and gives another context where we evaluate which medical groups and health plans consumers should hook up with and purchasers should consider. That's all I'll say.
Thanks. So I believe I've gotten through all of the questions that have come through online. Are there any more questions on the phone?
There are no further questions.
Great. Well, I just moved back to the slide with lots of contact information, so if folks do have further questions or more detail that we didn't answer here today, please do reach out.
Thanks, everybody, for your interest and the participation.